is hope for the mentee will be hopeful communities and children. It's led by Hadiza Umar, the executive director.
Thank you, Biaya. Shall I start?
Yes, please.
Could I share my screen, please, Marilyn? It says that I cannot share my screen. Oh, perfect. Thank you. Hadiza, I'll present the slides, but feel free to add or stop me at any point. So yeah, Hadiza and I were very working together very closely on the social norms mentorship piece, and of course Hadiza was leading a team, and she can tell you all about the team. Here I put a few slides on the mentorship process that started after the training. So the participants, of course, as you all know, some had already participated in a series of webinars on social norms, but some didn't. So in the first meetings, we started, of course, with introduction, with the creation of an action plan. What are we here for? What are our expected results? There was a self-assessment tool that H4CC completed in preparation of the meeting, so before we actually met. And we started discussing what they were actually doing. So H4CC presented their programs, their projects, what evaluation they had done and how. And this was kind of the first set of meetings. I know I only have a few minutes, so I will go quickly through these slides, and then Hadiza will add. But please, if there are questions, do feel free to put them in the chat or ask afterwards. After this first round of meeting, we moved into saying, okay, well, now, because not everyone has participated in the training, not everyone in the room, we started with recapping some aspects of social norms theory. What are social norms, how they're measured, how they're diagnosed, how do they influence violence against children, which was the focus of H4CC, etc., etc. And we started discussing, okay, now that we have a better understanding of social norms theory, what is the revised action plan? And we revised, of course, the action plan multiple times across these meetings as we were moving forwards. And we discussed the possibility of having homework. So we said, okay, well, between one meeting and the next, it would be great if the H4CC team could do some homework, which they really did, and it helped the process move much faster and steadily. Then the third slot of meetings was all dedicated to creating a theory of change, and there were several iterations. H4CC first started with every person, every team member preparing one theory of change, which of course created 8-9 different theories of change. And then we discussed on how to harmonize, how to revise them. And they eventually produced a theory of change that was bringing in all the different aspects of the different theories of change they produced, but that really served us as a starting point to say, okay, this is what we're doing now. This is why we're doing it. What is the place of social norms in this project and in this program? And that opened the door then to the next round of meetings. In this next round of meeting, we said, okay, H4CC is working on violence against children at school. We understand how the different pieces of the puzzle result in violence against children at school. We have now understood how the activities the H4CC puts in place try to change and prevent and respond to violence against children in school. But now we need to add the social norms piece in particular. And we started, again, brainstorming about what people knew, had seen, or what they thought the literature said about what social norms affected violence against children in school in the communities where they worked. And we did this 4 times, which was also an opportunity then to clarify in practice maybe understanding of social norms that were misaligned or not exactly coherent, internally coherent. So this was a work that went on. And the final version that we found very helpful was the version that you see in here, that we did for a multiplicity of practices. This is just one example of one practice. But we found it very easy for people to say, okay, if this is the practice, corporal punishment as a catalyst to learning, this is the kind of the thing that we'd like to change. What are the social norms that contribute to it? So who is the subject of this norm? Well, teachers. Okay, what do they believe? Teachers believe that. What's the reference group? Well, teachers believe that other teachers and school management will approve of them if they do what? If they use corporal punishment to force children to learn. And then how does this norm contribute to, let me annotate a little bit, is always helpful maybe. How does this social norm contributes to holding the practice in place? So if this is our social norm and this is the practice that we're interested in, well, in this case, teachers carry out punishment to be seen as good teachers by the management. And then we found a second social norm contributing to it. For instance, community members believe that, that's the subject, other community members and teachers would disapprove of them if they disapprove of the use of corporal punishment to force their children to learn. So community members believe that they cannot speak against corporal punishment. And that resulted in the fact that community members did not report any teachers for punishing their children. And then finally, a third social norm, and I'm not going to read it. And this is just one practice, but we really look at 3 different practices. I only put this one because it was for convenience, not to put them all, but we can give you the other examples too. So that led to the 5th round of meetings. After we created all these ideas, we said, okay, these are our ideas of social norms, but do they stand the test of the data? Is this true? Is this what's happening in the ground? So we created a research protocol to diagnose these social norms. We started brainstorming research questions, sample size, and particularly saying, okay, well, we have this social norm that results in not reporting sexual harassment against girls. What are the questions that we have related to that social norm? So, for instance, we want to understand why family, community, and school management support the non-reporting, how survivors feel about that, how has the action reduced or increased sexual harassment of girls, what action the school management and the communities take against the perpetrator to avoid, etc., etc., etc. So, for every social norm, we came up with preliminary research questions. Then what we did next is, from this brainstorming, we actually created a research protocol that had main research questions, a sample size, and we created data collection tools. We created data analysis processes, and this was all implemented by H4CC, who obtained ethical approval for the research. Then they collected the data, they did the analysis, and as we were in contact either on meetings or through emails, and they started the report drafting. And then after a couple of feedback on the reports, they finalized their findings into a report that is now finalized on the effect of social norms on sexual harassment and corporal punishment in public and private schools in Kaduna State, Nigeria. Now, the work ahead includes discussing the interpretation of these results, the implication, rather, of these results, especially with regard to the adaptation of the programmatic strategies. Okay, how do we need to change our program now that we have these findings? And then we move on to testing the new program, the H4CC Plus program, that includes also strategies to target the social norms that result in sexual harassment and corporal punishment at school, which will then be evaluated. So this is just an introduction. Hadiza, I don't know if you would like to add anything to what I just said.
Good evening, all. Well, hello, everyone, depending on where you are. Thank you very much, Dr. Ben. You've practically said basically all that needs to be said. It's been very thorough. Maybe based on the questions people might want to ask, then I could be able to add other things. Well, on the whole, the mentorship exercise was very, very educating for us. It wasn't as easy as the presentation was. We had our challenges coming green. But Dr. Ben was very patient and guided us well. And today we're proud of what we've come up with, and we're looking forward to how we can engage with the findings of the research and putting that into our everyday program, beginning to talk as a team on how we're going to, how it will affect our interventions going forward. Thank you.
Okay. Thank you so much, Ben and Hadiza, for sharing your perspective. Work on social norms mentorship. So next in the pair, we have Doug Evans, who is a professor of prevention and community health and of global health of the George Washington University. He's the mentor. Mentee is Kano State Primary Health Care Management Board, Family Planning and Vaccination Team. It will be led by Dr. Ahmed Habibu. Yeah.
Hi, thanks. This is Doug. So I didn't prepare a PowerPoint for today. So
no problem.
Yeah, so maybe I thought maybe we would just be talking kind of informally. So I will maybe I'll just give a few comments about kind of our process and what we did, and then hopefully Dr. Habibu or other members of the team, I think there are a few members from the Kano State team here, could talk about, reflect on the work and where they'd like to go next and what they've been doing more recently. So I'll just say a few things to kind of frame this. So I was honored and privileged to be able to work with the Kano State team, and we had a good process. We met a total of 9 times on Zoom, and this all happened between February and May of last year of 2021. And we did several things. We focused in on 2 specific subject areas that they are conducting programming in. And those 2 areas are the promotion of hepatitis B vaccination, and the other is family planning. And basically what we were about was trying to understand and come up with plans for addressing social norms related to those 2 topic areas. So we basically did 5 things. We reviewed previously developed or conducted formative research that the team and other colleagues had done on those 2 topics and the results of those research. And then based on that, we identified gaps and areas where there might be additional evidence or information that would be needed to really try to understand what underlies social norms related to those practices. So we identified recommendations for future research. We developed a set of SMART objectives. So these are, specific, measurable, and so forth objectives that could actually be used as a basis for developing well-developed and rigorous programming focused on the 2 areas of hepatitis B and family planning. And then we developed a kind of conceptual model for a theoretical model for how to address those SMART objectives. And then we developed a monitoring and evaluation plan. So we spent a lot of time really trying to understand the situation on the ground with the Kano State team. One thing we did was reviewed a fairly large scale study that had been done the year before in 2020, a mapping study, the Lafia mapping study in 5 states in northern Nigeria, which including Kano State, and also a self-assessment questionnaire that the team members completed. And we used that to really try to understand kind of the nature of the situation on the ground. And these in particular involved trying to understand factors related to low contraceptive use and the goals of expanding family and societal interventions across across Kano State and the other states that participated in this 5-state study. We reviewed a number of other sources of formative research. And one of the things that we identified was the need to really understand different segments of the population, in particular healthcare providers and their role in helping to shape and influence social norms related to Hep B vaccination and family planning, and try to understand various challenges that healthcare providers face in terms of delivering those services, what barriers they face in terms of persuading patients to accept the services, opportunities to increase vaccination and family planning utilization, things of that sort. And we tried to understand how to potentially segment the population. So for example, by gender, by healthcare provider role, such as doctor or nurse versus a community health worker, living in urban versus rural settings, higher and lower levels of education, and so forth. So trying to understand different segments of the population and how those might affect the social norms that actually specifically exist and need to be changed. And so we tried to break that down in terms of the 2 areas, hepatitis B and family planning. And one of the things we did was identify certain beliefs that exist. So for example, superstitious beliefs. Hepatitis B vaccination is supposed to happen during the first 40 days of an infant's life normally. And but there is a superstitious belief that exists in some populations that a mother shouldn't go out from the home during that early period, that certain bad things would happen to the baby if that happens. And there are actors within the extended family, like the grandmother in particular, the mother-in-law, so the father's grandmother, who would tend to set those rules. So we identified a number of potential sources of misinformation, for example, that might be influencing norms. And that's just one example I'm giving you. I'm going to try to move quickly here, but based on that, we identified a number of different types of research, like research to test various messages or intervention strategies that could be used to address this topic. And also the idea of conducting maybe a pilot study, developing an intervention and then testing it over a relatively short period of time. For example, to see if we could use an incentive system. Perhaps incentives might affect a mother's willingness to go get the vaccination in that early 40-day period. We did similar things with the family planning program. We identified various influencers like imams, for example, who could influence, who could become essentially like ambassadors or advocates for family planning potentially. And we identified some additional formative research and ideas for interventions that could be developed to try to address various sources of misinformation and help to understand the basis of the norms that are preventing widespread and effective use of modern family planning techniques. So we, based on, this was a series of meetings and discussions we held, and that led to the development of a series of SMART objectives, which I won't go into right now in detail, but I'll just maybe mention a couple of them. One of them was to increase the awareness of health benefits of hepatitis B vaccination by 25% among mothers and significant others within 12 months of being reached by the program. And an example for the family planning was to reduce negative or false beliefs about harmful side effects of family planning utilization by 25% among mothers and other significant members of the family within 12 months of being reached by the program. And there were a number of others that were involved with specific behaviors that we're trying to change and other determining factors related to the social norms for these 2 topic areas. So that's a lot of information. I'll stop, and that was basically our process. And we developed a report that laid out a series of recommendations for next steps for actually developing some of these ideas and programs and research that we had identified. And That's summarized in the report from last year. So I'll stop and see if maybe some members of the Kano team want to add or correct anything that I said incorrectly. Thank you.
Thank you so much, Professor. I'll go back to Ben and Yi. Yes, you started your mentorship relationship by assessing the needs of your organizations with regards to social norms.
I'm sorry.
You probably have. Okay.
We have one more.
All right then, Susan. The child is still alive and thrive. And as the mentor, while Susan is the mentee. So please go ahead.
I think Susan was not able to be with us today. She had communicated that earlier, so I don't believe she's here.
Stephanie is on the call and is prepared to speak on their behalf.
Good day, everyone. Good day, everyone. Susan indicated that she has a prior appointment, so she extends apologies. So very briefly, for our work with Susan, or Susan's work with us on this learning exercise, started really with a self assessment. She had given us a tool to do some kind of assessment, evaluating the organization and what we currently do on regarding social norms and areas where we thought that we needed support. And one of the things is that at the time we started, or at the time we went through this exercise, the project was closing out. So we had to then kind of co-design an action plan or come up with a scope of work on how to progress with the exercise in a way that was mutually beneficial to both Susan as our mentor and us as the mentee. And so going by that, we looked at the project, which was IYCF, infant and young child, an infant and young child feeding project with a strong bias to SBC and a lot of work that we did on social norms. So what we basically did, most of what we did was to look at documents that we had on the project. So we looked at our formative research, we looked at our theory of change, we discussed our midterm and end-term evaluation results, and well, some relevant documents to the exercise, and then kind of picked it out. And from what we found discussing our social you would speak in more detail to what the formative assessment encompassed. But as regards to, hello, can you hear me? It says my internet connection is unstable.
Yes, we can hear you.
Okay, all right.
Yeah, you loud and clear.
Okay, thank you. So the aspect of the formative research that we focused on was on the persona that we're able to identify in terms of key influencers of the behaviors that either positively affect uptake of IYCF behaviors by mothers or healthcare workers, or negate uptake of those practices, including norms around breastfeeding and dietary diversity that either promote or hinder the uptake. And then we also did some, she took us through some case studies just to broaden our understanding of the social norms, you know, trying to the injunctive and the descriptive norms, as it were. And one of the projects we looked at was a UNFA project on reproductive health about, I think, husbands or men in school, getting them to speak and promote reproductive health. But by and large, we also looked at our theory of change, and then she tasked us to think back on the project. Okay, so you did a formative assessment, you had the intention of shifting norms, but did you do it at the end of the day? And by the time we began to discuss all of that, we saw that, yes, we did say we will shift norms. We know that some norms shifted, but we did not measure that at the end term evaluation. So then she took us through an exercise on assessing social norms, on how to measure social norms. And interestingly, also the advocacy component of our work, she shared with us some resources on how to measure or monitor the impact or the outputs from our advocacy activities. Basically, it was quite an interesting time with Susan. We had a total of 10 sessions in all with her, and it was very interactive, and each session had to piggyback on the previous session before building forward and making progress. I don't know if AK would like to speak a little bit on the formative assessment, since that also formed a huge part of our discussions with Susan. AK, are you there?
Yes, I'm around. A good summary presentation, Stephanie, you did well. One of the key important components that I think we found in the mentoring that was very significant is how we were able to make reference to the formative research that was there at the inception of the project, but which we didn't seem to have factored it initially or understood the context clearly. But along the line, through the various sessions, each of the norms that were identified in the formative study was also put through the exercise, and to see exactly what was it, the norm that we were looking at. Bearing in mind, we had effort in our formative study to define personas that are significant in behaviors related to infant feeding practices. Trying to see the juxtaposition of the typically cosmopolitan families, what are the norms, compare that with the metropolitan families. In other words, we're looking at Lagos as a cosmopolitan, Kaduna as a metropolitan. Now, what were the norms that were significant that we needed to look at? And of course, somewhere we had another group that we considered to be rural, as what were the differences and what was the denominator that were significant for all this. In other words, what influenced the norms? Were they institutional? Were they organizational? Were they structural? Now, these were the things that were considered, and then we kind of like put them through the test. Now, the team in 11 Tribe, looking at the composition, we had an MIE expert participating actively. We had experts in interpersonal communication, and see how do we interpret all these things and make sense. So I think what was very important for us in the learning phase was to say that, are we able also to import this learning at that time while we were working in the proposal that we were working on for the new project? Because the new project was to scale up the mycin practices, in other words, maternal and infant feeding practices. Then looking at it now, are there norms, are there learnings that were significant for us from that 10 sessions that we think could help, which I think it did a lot, tremendously, almost at every point of our writing of the business plan. It became very obvious that are we talking about certain social norms that are very fundamental for our project, or are we just writing things? But I think it did provide that foundation which we needed in the next phase of the work, which was just starting. Over.
Okay, thank you very much, AK. And so one of the last exercises we did with her was to think through, because we had asked her to kind of like stimulate us on developing a theory of change from scratch. And we found that it was more tasking than we had imagined. And so looking at the project at the time, we looked around structural shifts, individual shifts, and social environmental shifts. And just as AK said, because it was at the end of the project, one of the takeaways for us then was to see how we could take forward the learning and impute it not just in the program design, but also be intentional about measuring the social norms once we rolled out the new project, which has just begun. Thank you. Over to you. Over, Marilyn.
Hello, Marilyn.
Thank you, Stephanie, for giving us your perspective on what you did. And indeed, everyone, for sharing your perspective. We're supposed to go through the first round of questions, but the first one is like most of you have already delved into that. And in the interest of our time, we'll just in case you didn't make mention of that, can you please share with us how you did your needs assessment of your organization?
Sorry, Marilyn, what's your question?
Yes. Would like to know at the beginning of your mentorship relationship, how you did your needs assessment, as the needs assessment of your organization with regards to social norms work.
I think maybe before Stephanie comes in to add more, we had a 2-session exercise which was more like fundamental for the need assessment, and I think Suzanne did a good work on that, because we had to individually define what exactly do we want to learn, and then what aspect of the learning do we think we'll want to see we go through. So we had a big picture first of all, and then picking through, and then looking at it from different angles of the justifying why each one of us felt that was the most important aspect that we should consider. And then by the second or third session, I think thereabout, we're able to come up to a harmony of identifying areas of that we think this is common and applicable to all of us that we can be able to move through. Now, why it was much easier for us is probably the consideration that we all coming from a project that is fundamentally a behavior change project, and then we needed to see that there is a common need and understanding right from the conception in terms of the what do we want to do and what do we want to evaluate and how do we go about evaluating, so that each technical areas and technical expertise can see the linkage on that. So the subsequent learnings, therefore, proceeded in looking at those specific needs. For instance, from the evaluation perspective, the MIE and indicators to measure social norms, the colleagues were also interested to see what exactly are we measuring? Are we measuring a norm shift or change in behavior in particular, or what exactly do we want to see? These are the norms that are measurable and we can measure them. And that applies also to the capacity building, to training, and then to the various components of the project. Over,
Okay.
Stephanie?
Well, thank you. We would like to hear from others as well. We are actually running out of time, so I think maybe 2 minutes will be sufficient.
Okay, hello.
Ben, yeah.
For H4CC. For H4CC, actually, when we started out, we're not really sure what our needs are, because we had a lot of focal areas that we're looking at, and Dr. Ben helped us to narrow down by asking us. It was just like doing a YY analysis, and in the end, I think it came out clearly that our focus generally was on gender as an organization, irrespective of the fact that we were looking at health, education, governance, and so on. But the crux of what we're doing was gender, and that was how comes we were able to come to draw up our theory of change, and it just fit in and gave us a sense of belonging where we actually were. Because before the mentorship exercise, it was like, after looking at everything now, it was more like we were vague, touching on everything, but really didn't know where our substance was. So every team member was part of it, and it gave us an opportunity to be able to narrow down. And today, we will definitely, anytime anyone asks us, we'll tell us first, we are an organization that is focused on gender, though we touch on other focal areas as it affects our area of work.
Hello.
Hi, can hear you.
Yeah, I think our own from Kano, initially during the mentorship, just like Kaduna say, it's kind of not clear. But gradually we are able to understand what we need to do, and are able to set objective together, and even going down further to demystify what are the cultural barriers to these two things that we have agreed to work on, that is the hepatitis B0 and contraceptive uptake. But toward the end, we have formed a harmony, and we are able to work and come up with a lot of strategies, even segregating the thing, that's the one coming from the healthcare aspect and the community aspect. And at least from the point we have stopped to now, I think from the healthcare aspect, which we have direct influence on, we have really make a lot of progress, especially as it relates to hepatitis B0. And I'm happy to announce, I think for this February, January data that we have analyzed, there's an increment in the coverage of hepatitis B0, even though not much, at least by around 8%. And we are still working with the community people to see how we can implement other community engagement strategy to have a norm shift so that some of the myths will be demystified. And just like Dr. Evans has said, we're also working on to see how we can incentivize this as caregivers so that more of them will come off to receive. And one thing to clarify, I think hepatitis B0 is supposed to be given 14 days after delivery. After 14 days, then the child will miss that chance. So that's one of the reasons it's very important. And one of the things that he was trying to mention is that at the custom we have found is that women at the rural areas don't come out till after 40 days. This is kind of a cultural thing. And this is one of the things that we're trying to address for that issue. And I think this, all I could say relating to hepatitis B, over and out. I think my colleague can talk about the consultative adult center. Thank you.
Well, it's fine. Looks like we're running out of time. So we'll go to the next round of questions. I want to know what were some of the challenges that you faced and how you were able to overcome them. Ben and team?
I think, Hadiza, I'd like to know what you think, but I can just mention one maybe. I think it's difficult to, so the organizations have many priorities, and so they have much more to do than just work on the social norms piece. And of course, H4CC was they were very talented, motivated, very capable, very clever, all of them. But of course, this work also needed to be part of their daily routine. So maybe that's one point. I don't know, Hadiza, what do you think?
Actually, Doctor, you're right. And also part of the challenges we had was the fact that at a time when we were having those, the mentorship program, we had a lot of infrastructure development going. So network, sometimes we had network problem, that was internet connection. And then sometimes time, the tasks, we had to think through some of them a lot. And at some point, we could find a situation whereby we were not coming forth timely. But like he rightly also said, yes, we had so many things going. So it was really, I would really like to commend Doctor for helping us to be able to pin down to where our core was. That was, I think, the major thing for us. Thank you.
Okay, please, for the participants, if you have any questions, you can put up your hand or drop in the chat box when we get there. With the questions, we actually eaten into the Q&A session, but we'll round up with the questions. Maybe Dr. Evans and Tim will share with us what was one thing that surprised you during the mentorship. Professor Doug and Tim. Okay. Stephanie, can you share that?
I think there's a hand up. Hadiza?
Yes, thank you very much for this. My name is Hadiza. So this is really interesting, and we know that social norms drive all the inequalities that we see in Nigeria and other parts of the world. For the mentors and the mentees, was there a systemic approach in terms of analyzing the norms and building this into the program, or was it very much context specific and driven by the resources and what was available for the program and the capacity of the mentees?
Okay.
I mean, I'll just speak for the work. I'll just speak for the work I did with the Kano team. I think, you know, we did use a common approach across the projects. I think, you know, the mentors met a number of times prior to and during the engagements. And so I think we did use, you know, a common approach based on social norms theory and the effort to, you know, understand the circumstances surrounding the specific topics that we were working on and what the local norms were, and to try to understand the research that had been done on those, and then, you know, eventually develop a conceptual model and objectives for future programs and evaluations. So I think we did definitely use a common kind of methodology, but we applied it somewhat differently because the circumstances of the different organizations that we were working with were quite different, and the topics were quite different. So I guess that would be my comment.
Thank you so much for your take on that. I would also like to know, since the technical assistance ended, how have you continued to integrate social norms into your programs? We start with FHI, Stephanie.
Hello, sorry, can you, my internet
Since
keeps
the TA ended, how have you continued to integrate social norms into your program?
Okay, so like we said earlier, we just started the new grant. We are still in the startup phase, but we did take into account previous experience and what we learned from the exercise working with Susan. We took account of that when we're developing the project document. And so for us, it's kind of like starting all over since the mentorship program ended. So this is like starting from the very beginning, where we'll then begin to apply. So this time around, beyond just saying that the project will shift norms, we're going to be intentional about it, especially now that we've been armed with tools on how to measure social norms, which we didn't do in the past. Thank you.
Okay, thank you so much. Inside. So what advice do you have for others who would like to have a stronger norms focus in their programs?
I think, sorry to speak again, I would advise that other organizations don't focus only on the people who specifically work in the behavior change aspects, because for us, one of the things we found is that we brought together the 4 components of our work, which is policy advocacy, mass media, mass communication, interpersonal communication, and community mobilization, and strategic use of data. At the point where we started, it was kind of like just, okay, this is something that is very foundational to us as an organization and as a project. So it would be nice for all the technical components to be on board, at least to have some understanding of social norms. But by the time we began to engage, we realized that social norms cuts across all the entire 4 prongs of our project implementation. So there was something in there that the policy advisor took away. There was something in there that the IPCCM advisor took away. There was something in there that the M&E advisor took away. So everybody has something to learn. And once everybody who is critical to program planning and implementation is on the same page, then not only the implementation becomes easier, but even the monitoring and evaluation of it becomes easier. Thank you.
Well, thank you so much, everyone, for the mentors and the mentees, giving us your perspectives on what works you have done. And all the participants, thank you for joining us. And I'll hand you over to Marilyn.
Thank you, Professor Biaya. Thank you, everyone, for sharing. I think there were a few questions for specific people in the chat. I think one thing we could do is maybe put together those questions and share them with the mentors, and then they could respond and we'll share with the larger group. So if that's fine with everyone, I think we'll just go ahead and yeah, just take that approach. But look, we could use the last minute to answer one question. There was a question about if there's like a particular methodology recommended for people who are interested in integrating norms into their programs. Would just one person in the last few seconds we have? like to address that question?
Sorry, what was the question again?
Or if there's a particular methodology recommended for integrating norms into programs.
AK, I think you should respond to that. Is AK still there?
Okay. I mean, I think now we're on the hour, and I do not want to, but I was just hoping we could at least take in one more question. Thank you everyone for joining. We look forward to having more of such opportunities to just share and learn just learn about what we're doing with social norms in Nigeria and I mean across the globe. Look forward to having you join the next one. Thank you everyone for coming. We'll go ahead and end the meeting shortly.
Thank you.
Thank you, everyone. Thank you very much.
Thanks, everyone.
Thank you, everyone.
Bye-bye.
Thank you. Bye.
Thank you, everyone.